Hello everyone. First of all, I thank Eurasia Research for allowing me and accepting my research proposal and abstract to be presented in the conference. My study is on the impact of COVID-19 lockdowns on gender-based violence, the challenges faced by women victims in Mauritius. So, gender-based violence, as we know, is a phenomenon which is strongly embedded in different societies around the world. It is one of the main violations of human rights and aims at targeting one person primarily due to their gender. Both men and women are victims, but no one's. Harmful behaviors associated with GBV are physical, verbal, emotional, and sexual abuse of the wife, undernourishment of girls and daughters, women and girls forced into sex work, female genital mutilation, amongst others. The violence can also be psychological in the sense that women feel excluded from the society among their friends, families, and social circles. The UN has labeled GBV as a global issue in terms of health and development and has highlighted the need to put in place policies, programs, sensitization campaigns all around the world with a view to preventing violence against women. Therefore, GBV is also associated with not only morbidity and mortality of women, but also health complications and implications for themselves and their children. Violence against women occurs around the world regardless of race, color, creed, and community. The COVID-19 pandemic has resurfaced existing inequalities, whether it is in the socio-economic or cultural systems around the world, and we have witnessed a rise in the number of cases of GVB during the emergency quarantine. In a situation where half of the world population were confined to the four walls of the house, the rate of gender-based violence had increased drastically in almost all the countries, as you can see the figures in the slides. Mauritius, at the same time, a small country in the Indian Ocean, wasn't spared from the global epidemic of gender-based violence. So we do have a lot of cases of violence, domestic violence, intimate partner violence in the country, urging the different stakeholders to take actions to prevent the cases from rising up. Due to the fact that Mauritius is a highly patriarchal society, the country has also witnessed a number of passionate crimes in the last decade. Not only that, during the COVID-19 pandemic, we have seen a rise in the number of GBV cases. Only 18 days, there were an increase of 293 reported cases of GBV in Mauritius, the underreported cases being unknown. The victims had no choice to stay but with their perpetrators. 520 cases were reported to the Family Police Unit during the first lockdown, 39 of which were male victims and 481 were female victims. Around 111 female victims had to be placed in a shelter during the lockdown as their lives were in danger. So all these are indications of the vulnerability of women and girls, especially in a patriarchal setting. So the key to preventing domestic violence is therefore changing the attitudes and behavior conducive to this form of violence. Consequently, this study examines the lived experiences of women victims of GBV amid the COVID-19 pandemic. The researcher identifies the main factors causing GBV in Mauritius during the lockdown, examines the victims' knowledge of GBV and its implications, as well as investigates on the coping strategies the victims used in their daily routine. It is also important to note that Mauritius had witnessed two lockdowns, one being a full lockdown and the second one a partial one. With the literature, we find a lot of information regarding definitions, regarding figures, facts and figures around the world, also and in Mauritius. So domestic violence is defined by the WHO as the use of force, physical strength, on another person or another group of individuals that result to mental health problems and injuries. With regards to gender-based violence, it is mainly on a one-to-one basis, that is either from husband to wife and wife to husband or partners. So gender-related deaths have increased drastically from 2019 to 2020 across the world due to the COVID-19 pandemic. Here we have some figures in the Western Pacific, Mediterranean Ocean, and the Southeast Asia. The pandemic had impacted on families worldwide, both economically and socially. Among the different forms, we also have STDs, burns and bruises, injuries, pelvic inflammatory diseases, and menstrual irregularities. Among the psychological problems are post-traumatic stress disorder, depression, anxiety, low self-esteem, insomnia, increased substance abuse, self-harm, and suicidal thoughts. According to the UN, GBV had increased drastically due to economic stress and uncertainty among people, coupled with restricted movement and isolation. Thus, GBV is one of the main challenges of women's health and well-being. Methodology: the current study employed an exploratory qualitative method among victims who encountered gender-based violence amid the COVID-19 lockdown. While exploring human actions and experiences which cannot be quantified, qualitative approach was deemed most appropriate for this study. It was conducted in a shelter where the victims were brought after the intervention of the police and family support during the confinement period. Qualitative approach was also appropriate for a study of this nature because it gives in-depth information and details of the phenomena being studied. The method allowed for the opportunity to provide insight into the world of the participants in their own language and promote self-disclosure in a friendly and confidential environment. 13 victims who faced GBV amid the COVID-19 pandemic were selected using the snowball sampling technique. They were interviewed using the semi-structured in-depth interviews approach. The participants were aged between 23 to 48 years. An open-ended interview schedule was used to guide discussions within the participants. Along with the in-depth interviews, focus group discussions were carried out among family protection officers from the Ministry of Gender Equality, Child Development and Family Welfare, and Police Family Protection Unit. The guiding questions for the officers consisted mainly about what type of support they would provide to the victims, and the emergency measures they adopted. So immediately after each interview, the data was transcribed and translated into English. The data was then analyzed thematically using Brown and Clark thematic analysis, which consisted of the following steps: becoming familiar with the data, generating the codes and themes, reviewing the themes and defining them. The main themes identified from the in-depth interviews with the GBV victims are economic insecurity, increased anxiety and depression, lack of support systems, health complications, stigma, guilt and discrimination. In the following slides, we are going to look at one by one the different themes. Economic insecurity. The majority of women interviewed encountered problems with their jobs and had unstable income. They were either working in private informal sector, the tourism sector, or they had small businesses. The respondents had no choice to stay at home and were thus financially dependent on their husbands. Some had loosened their jobs and their contracts were not renewed. Anxiety and depression. Another recurrent theme encountered in this study is about anxiety and depression that the victims of GBV faced amid the COVID-19 pandemic. One respondent, Rani, mentioned that she was always in a state of constant fear because her husband would become very violent at any moment. Another participant, Lama, stated, "My children and myself were witnessing my husband's harsh and foul words on a permanent basis. We had to obey his orders and he would beat us if we didn't reply to his commands. This was really stressful and we were quite depressed." I said in the literature, Rod et al. Revealed that time during the pandemic had come to a standstill, and this was associated with increased challenges of depression, anxiety symptoms, which can be worse for the GBV victim. Another theme came out from this study was health complications. The victims of GBV, women in particular, revealed that they experience a lot of challenges and barriers to have access to their routine health care, as well as taking their medications regularly. One respondent, Dewey, from the current study mentioned that she couldn't buy her medications once her stock was over. Her husband, a drug addict, was never concerned with that, and as a result, both her diabetes and blood pressure levels would rise. She felt unwell, dizzy, but she had no choice than to manage without her medications. Thus, we see a heightened risk of negative health complications due to lack of healthcare support from partners, husband, and economic problems for women, typically during the pandemic. Stigma, self-blame, and guilt. Stigma in the context of the COVID-19 pandemic is also an ongoing phase of self-blame and tolerance for gender-based violence victims. In the current study, the majority of the respondents reported that they had absolutely no support from other family members when they faced either physical or psychological abuse from their partners or husbands. This is considered as normal, as we have seen in the literature, where Mauritius is a highly patriarchal society in nature, so violence against women is not really voiced out. The victims are sometimes even blamed for their behavior and physical appearance, causing them to internalize the guilt and accept the blame. They feel stigmatized due to their sufferings and are discouraged to voice out. The majority of respondents in the study talked about being blamed by their in-laws whenever they would face violent behaviors, thus encouraging the perpetrators to continue harming their victims, either physically or psychologically. Another theme was lack of support systems. The majority of GBV victims reported that they lacked support in all its forms during the lockdown. They were confined to the four walls of the house. Shelters were almost closed. They wouldn't have access to basic amenities and felt helpless. They had only hotlines where they would call the family police unit, and officers from the ministry could attend to only by phone, and no visits were allowed during the lockdown period. Results from the FDGs with the personnel. The police officers revealed that they had many cases of gender-based violence to deal with during the pandemic. However, the available support was only free hotline. The majority of victims could not be relocated because the police didn't receive the orders. The confinement orders were very strict and there were no choice but to adhere to the rules and regulation. One police state officer stated, "We received several calls where the victims were enduring physical violence. We tried to talk to them and even went to their residence but could not do more. In a few cases where the lives of the victims were in danger, we had to issue protection orders. The Family Welfare Protection Officer from the Ministry of Gender then would accompany to take the victims to some shelters which were operating under strict guidance." The data revealed that the focus group discussion showed there were some shelters operating during the lockdown period, but under strict surveillance. The Family Welfare Protection Officer were involved in the case and they accompanied the victims from their residence to the shelters. They were equipped with the Work Access Permit (WAP) and had frequent visits to the victims' residence. However, the officers also revealed that the COVID-19 lockdown were very stressful. They had to work under harsh conditions, risking their lives being exposed to the virus. and they were very concentrated for their concern for their families who were also at risk. On a conclusive note, we've seen in this paper that the GBV victims have been facing numerous challenges during the COVID-19 pandemic lockdown. The main themes emerging from this study are economic insecurity, anxiety and depression, health complications and mental health problems, stigma and self-blame, and lack of support systems. The FDGs with the personnel revealed the absence of support to GBV victims during the confinement period. There is thus a need to have a more holistic approach towards emergency crises such as COVID-19 lockdown in the future. A preparedness plan or a backup plan for all institutions relating to GBV such as healthcare professionals, psychologists, counselors, the court, the justice system and the family police unit. I thank you for your attention.